Today, we have a very special guest joining us, Dr. Julie Carbray. Julie is a psychiatric nurse practitioner and a clinical professor of psychiatry and nursing at the University of Illinois at Chicago. And as you all know, she is an adored member of the Psych Congress Steering Committee. Thank you so much for joining me today, Julie.
Oh, it's really great to have this opportunity to get to talk to our family, our Psych Congress family, Sandra. Thank you.
You bet. Now, Julie, I trust that you and your loved ones are all doing well during these difficult times.
Yeah, we're very fortunate. My college kids are home, and I'm now working from home, and we're doing well. So thanks for asking.
Absolutely. That's really, really good news to hear that everybody's well. You know, Julie, I've heard a little bit this phrase about the new normal. And as I think about it, I feel like this new normal, it really is requiring all of us to make a lot of changes, both professionally and personally. So I was thinking that we could begin by talking about the professional changes that probably all of us have been dealing with. So Julie, I'm wondering, for you, what changes have you made in your practice or even in your academic setting in this new era of COVID-19?
Wow, Sandra, so many changes in my professional life. I am in an academic setting, so first off, we have students to worry about. I have nurse practitioner students who have been in their clinical practicums with me, and we're getting pretty close to when they should have wrapped things up, and we have done our very best to find ways to be able to accommodate their practicums, to keep them moving forward with their programs. Our residents are still having didactic experiences that we need to plan for. Our medical students, we're still trying to connect with. So it's really taking us a lot off balance as a faculty to stop, regroup, and think about how we can help everybody get to the end of their training year in a successful way so that they're getting those clinical experiences. From a clinical standpoint, that's been a super big change too. We have been quickly propelled into telehealth, and because I work in child and adolescent, many of our adolescents are very friendly with using video to be able to convey their feelings. They're very comfortable, but it's been a challenge to get a whole family on together for a family visit. It has taken us a lot of sort of rebooting how we typically do things. I was in the office all this week covering for some of our colleagues who aren't able to make it in because they're at a higher risk than I am right now. So I've been filling in for some of those colleagues. And I looked around my office where there's toys and everything is clean and sterile right now, and there's nobody really to play. So what we've been doing is really using this new medium of video telehealth to be able to connect with families during this time. And I've frankly have been very amazed at just how busy we've been with connecting with patients. As it first hit us, I felt like it was a big surprise. Everybody was numb. Our phones were silent. And as the days have been moving forward, our families have been reaching out. We've been reaching out to our families, and the days are very long in trying to support our families. So I think for myself, there's been a lot of trying to stay ahead of what we need to do next to make sure that everybody's safe. Our students are busy. Our patients feel safe, and that we're all in this together. I really feel that way. This is one trauma where we are peers with our patients and our families. We're all in this together, and so I think that's been propelling my energy for these long days.
I think you're exactly right, Julie. Thank you so much for sharing that. Your description about sort of the changes with the children, particularly with play therapy, and thinking about on the other end of that the adolescents are so adept at social media and these platforms, so many different adjustments. And one of the things I thought about as you were speaking is this. that I know that in the upcoming months, in the fall, you're going to be presenting at the national meeting. And I believe your topic is solving clinical challenges in child and adolescent psychiatry. And
Yes.
I just couldn't help but wonder, what are you seeing, even in these early stages, with children and adolescents in your clinical setting in relationship to COVID-19? How are they dealing with this? What's the impact to them as children and adolescents?
You know, there's two sides of this. One is adolescents who are saying, I want to know when this is done. Like, I can do this right now, but for how much longer? And sitting in that uncertainty is hard for all of us. But I think for teenagers who maybe were set to graduate, teenagers who can't see their friends or their boyfriends right now, they just want to know, how much longer can I do this? So this is limitless for them right now. And they feel more infallible by the threat of the virus. I think children, what I'm seeing is they're moving on with their day, and they're really looking to their parents for the tone of what's going on in their lives. We did have our first family affected by the virus, and we had a lovely family visit yesterday with them, and the kids expressed some concern over their parent who was in the hospital at this time, but they would express their concern, and they would talk a little bit about their feelings, and then they would play. And we would just sort of watch them go and play, and then they'd come back and they'd say, and can I also tell you about this? So in many ways, it's very much like having them in the office. And kids need to do that. Kids can be very resilient. We all can be very resilient, but they're really looking to their parents, and they're looking to us right now for some education and some guidance and some calm in the midst of their lives that are really uprooted. The additional challenge, I think, for us in child and adolescent has been suddenly parents are now the teachers for their children. Many kids are homeschooled during this time, and parents who were working are not working. And so there's a lot of role confusion. And so we've been trying to coach parents on how to manage the school day in less time, really, than what a school day typically is, and to set their expectations differently. And on the other side of that, our teenagers are really struggling with motivation. Our college students are struggling with motivation. This is a very distracting crisis for all of us. And so helping kids to focus on what they can do during this time, giving themselves a break, encouraging them to ask their family members or their friends for support when they need it, and really building up those daily routines when all of their typical daily routines have been challenged has been where I find myself spending a lot of time, whether they're teens or they're parents of teens, or parents of younger children or the little ones. The little ones love coming and sort of checking out what's going on and showing me pets and toys, and it's brought a nice level of intimacy. It reminds me of old days when we used to do home visits with families a lot. It's much more intimate, and I think that this whole crisis that we're all going through together too, it's like we're all coming to the table understanding already that that's a stress on top of what we know they've been struggling against to begin with.
Yeah, as I'm listening to you, what you're describing really reminds me of so many conversations. And I know that our viewers, our Psych Congress family members, our colleagues, our clinicians, they're all thinking, I know that family. I know that.
Yeah.
And what's interesting about it, Julie, is that there's disruption for these children and adolescents, just like we were talking about the disruptions to us, both professionally and personally. And I think what you said when we began that's so powerful is that we're in this together. We're more closely connected with our patients in a very different way than before. And that together, we're just going to have to fall back on that foundation of resilience. So thank you for sharing that. I know that it must have resonated with our viewers. So I'm sitting here thinking, I'm wondering, Julie's top 3 learnings. What are the 3 things you've learned that have been most important, whether they're professional or personal, in this era of COVID-19?
Yeah, in these.
No, go ahead.
Yeah, in these days, it can feel like we have very little control over anything, and I've hinged my thoughts and my actions actually on these 3 H's in my head, like what can I do to maintain my health during this time and the health of my family and of my patients? What can I do to be helpful during this time, whether it's my family connecting patients to each other or to their care or reaching out? And then what can I do to help keep myself and others hopeful? Because I am hopeful. And I know that if I can help my patients, if I can help my family to do healthy things. So we're trying to boost our immune systems here. We're trying to eat healthy. We're doing some great exercise. We're walking the dog more than she probably has ever been walked. We even did yoga. I did yoga with my college son and my husband the other night for the first time ever. We're trying to be healthy and trying to be helpful, connecting with family members over FaceTime or Zoom, and connecting with patients I might have not have connected with recently, but I just want to check in on them. So feeling in some way that I could be helpful, and of course to our students and reaching out. And then also, what can I do just to set my eyes on life after this? There will be an end to this. So how do we together just show hopefulness? And so I think what I've been finding helps the most with that hopefulness is connecting with others, laughing, and thinking ahead to what things will look like when we can walk out of this. So that's a conversation I've been having a lot.
I love that, Julie. As I'm sitting here thinking, healthy, helpful, and hopeful, the 3 H's during COVID-19, because that encapsulates really what we're all trying to do. And the 3 H's is a nice way to remember it. So I love that. I think that we should all our viewers should begin talking about those 3 H's. That's going to ring a bell for all of us.
Well, and we could even add a fourth, which I'm really missing, seeing my Psych Congress family at Elevate recently, and we'll see you soon. And when I see you all in the fall, because we're huggers. And it's really hard when you're a hugger to not hug, but I can't wait for that to be able to be okay again, because it will be wonderful to get to see everybody on the other side of this.
Yeah, I imagine this. I imagine when those restrictions are lifted and we get to see each other and hug each other, I bet we're going to appreciate it even more, right?
I agree.
Well, Julie, we only have a few minutes left together. So there's one question I don't want to overlook asking you. You've referenced it a little bit before, but I really want to take the time to ask you this. In your personal life, what changes or adjustments have you really had to make in response to COVID-19?
Yeah, I think I'm somebody who's on the go a lot, and to be grounded, I guess I'm relating to my teenagers. To be grounded it feels almost punishing. And I never realized how often I would just go grab a cup of coffee or pop over to a neighbor's house, or, just that lack of freedom, I think, has probably been more challenging for me than I would have imagined. And sort of stopping myself from a hug. When I've been in the clinic yet, we're all at a distance and we're doing this. Hi. We're sort of showing affection.
Right.
So that's been hard. And the largest thing that's been hard for me is I had a new grandbaby born in February, and I've only gotten to see her right after she was born. So I think for myself, the biggest challenge has been that the travel restrictions have made it so that we do not get to see each other as often as we probably would have seen each other a couple times by now. But I'm somebody who does always take a look at the good side of things. And the good side of things is that my daughter has been great about sharing videos and pictures. And in fact, I could probably pull one up and just show you the sweetest little face that I got today. So I think that's been helpful. So rather than focusing on what I'm missing out on, which really, like everybody, is a lot right now, I'm really focused on what I can't wait to get back to.
Absolutely. I'm thinking, I was going to share with my Psych Congress family that I've actually seen a little picture of Julie's granddaughter, and oh my, she is lovely. So focusing, I think you made good points, Julie, that if we focus on the positive things in spite of all the disruptions, there is an end to this. There's a way to come together and just deal with it in a positive way. So thank you for sharing that with us. I'm just so happy to spend time with you today, talking about what you've been learning, what you're experiencing, the opportunity for us to be able to connect with our Psych Congress family, even if it's through video and not face-to-face. We found a way to deal with this in a positive, fun way. So I really want to thank you, Julie. I really appreciate it.
It was great to see you, and I can't wait to give a hug.
Right back at you. So I'm going to turn my attention just for a moment, Julie, to our larger Psych Congress family, just to tell each and every one of you that we send our very best to you. I wish that you stay healthy, that you'll be well, and I'll talk to you really soon. So bye for now from me and Julie.
Bye, everybody.